Well, hello everyone. This is Jeff Marks, and we are going to go over training session number 2 and review the pharmacy savings card. Very important benefit. Today, more than 30 million individuals in the U.S. don't have any access to pharmacy benefit management wholesale pricing whatsoever. But even for those who do, the trend in the healthcare industry is showing that fewer drugs are being covered by insurance. More individuals are being required to pay a high deductible before their insurance kicks in. The healthcare exchanges, in many cases, you're going to go to the pharmacy with a prescription, and the pharmacist is going to say, "I'm sorry, this drug isn't on your plan." And people are going to really be stuck, or they're going to be told, you've got to pay the first $500 or $1,000 before your insurance kicks in. So, once again, pharmacy is going to become much more consumer-oriented. And even now, people who do have a pharmacy benefit, even though many drugs won't be on their formularies in the future, right now, this list below, cosmetic drugs, appetite suppressants, quit smoking prescriptions, prenatal vitamin, nutritional supplies, injectables, contraceptives, immunizations, they are not covered by anybody's insurance whatsoever. So pharmacy discount cards, companion cards are becoming very popular because we cover every single prescription. And there is a big difference between these different discount cards. So let's talk about what makes our card different. We work with a company called DataRx. DataRx is unique because it owns its own pharmacy network. What that means, it has negotiated contracts with every single major chain in America and most independent pharmacies. So they have a network of 63,000 pharmacies. But because they have direct contracts and the way those contracts are priced, they can pass on tremendous savings to the consumer. So consumer gets 11 to 75% off, but overall average last year was 53% off retail price. The closest competitor is about 40%. Most discount cards are in the 20 to 30% range. So this card has significant discounts. Other consumer features that come with this card are a pharmacy locator and a price finder online. Why this is so significant is, once again, let's say you get a prescription for Lipitor, and this is just a sample of what somebody would see online, and they type in Lipitor 40 milligrams. Well, it says the retail price on that drug is $198, and the discounted price is $169. So savings is 14%. Still pretty darn expensive. If you do have insurance, okay, if you have an insurance card, great. Lipitor is still going to probably be a Tier 3 drug and cost you $50 to $65 or more to get, which is a whole lot better than a discount. But what most people don't realize is there's many other drugs in the same therapeutic class that cost far less. So we try to educate the consumer and let them see what else is out there that can do the same thing. And of course, they would need to call their doctor and ask, if this drug is just as good, would you rewrite the prescription? But 99 out of 100 doctors would be glad to rewrite Lipitor into a Simvastatin generic for $11.30 a month, which is a 92% savings. So this tool alone, whether you do or don't have a pharmacy card, insurance, this benefit alone can educate a lot of people to go in the right direction. Other benefits come with this card. Quit smoking program. Like I said, quit smoking programs are not covered by insurance. So we have an arrangement with Shantex where people get a significant discount on their prescription. You got to get a prescription first. After the first 90 days, it's a 90-day program, they get an additional $30 rebate card for fulfilling all 3 months of the prescription, and they get a 1-year educational program online. This program is actually very successful. It's about a 40% success rate. So employers love having a quit smoking program that's built into their pharmacy card. We also offer, for those who need it, lab and imaging discounts, particularly those on mini meds or very high deductible plans or no insurance. If somebody's, say, got an HSA account, they have made a decision to take care of their health and save that money that they don't need for health care expenses. But what if they go out and play tennis and blow their knee out? That can eat up their $3,000, $4,000, $5,000 deductible pretty quickly. We have arrangements for lab testing and imaging where in a matter of 15 minutes on a telephone call or online, you can get price quoted and have that lab test taken, paid for, have a voucher, walk into LabCorp or get your imaging arranged at deep, deep discounts before you even walk into the door. So this is a tremendous program. We also have discounts on diabetic supplies, discounts on vitamins, and a remarkable feature, which is a huge benefit to the business community, corporations, because they're all promoting health and wellness. They want people to be more literate, more educated. They've got all kinds of wellness programs to teach people to change their behavior. Well, we've got a website that is included in this program called Health and Wellness Focus, which is every bit as robust as WebMD, only there's no advertising to confuse it. It's very easy to read. It's written on, probably an 8th grade level. It's broken down into disease conditions and drugs and self-care and kids and adults and seniors and men and women, and it's just very easy to learn information online with this website. So it has tremendous value. So bottom line, who can benefit from our pharmacy card? Well, people who don't have any medical coverage, people whose insurance plan actually costs more than a discount card, people who are taking drugs that aren't covered by their insurance, those with high copays or deductibles, those using other discount cards. And what most people really don't realize is there's 33,000 prescriptions below $7. So even if you have an insurance card, typically you're going to pay $10 to $15 copay. Take the discount card to the pharmacist and simply tell them, put both in the computer, tell me which one is the best price for me. And you don't have to do it again. Once it's in the computer, it's in. So that's the discount pharmacy card. Thank you for your time. Next training session will be on telemedicine. Thank you.